part of the reason why the Kardashians were using our product to begin with is Hyperbarics has a pretty strong effect on collagen production. Hyperbarics can now help facilitate and stimulate angiogenesis to build new capillary beds and to really make sure that we're maintaining adequate flow and oxygen delivery to our skin. Hyperbarics has a very strong anti-inflammatory effect to help bring down some of that inflammation. So bacteria don't thrive in a high oxygen environment. By putting them in a high oxygen environment, you're now suppressing their ability to grow and maybe even decreasing some of the populations there. And so that, of course, gives your body a chance to really optimize itself.
I've been in the health and wellness space for about 15 years now. So I've seen a lot, I've done a lot, I've tried a lot of different things, and there hasn't been something I was this excited about in a while. So back in November of last year, Paige and I actually went down to LA to check out OxyHealth, which is an incredible hyperbaric chamber manufacturer. So today, like I said, we're diving into this world of hyperbaric therapy. Maybe you've heard about it, maybe you haven't heard about it, but this is one of the things I've been most excited about in a really long time. So Dr. Mayur Patel, CEO of OxyHealth, the global leader in hyperbaric solutions, who's continuing the legacy of his father, Mayur Patel. Mayur is on a really incredible and powerful mission to push the boundaries of wellness and make hyperbaric therapy more accessible than ever. Now, with a doctorate in pharmacy and a bachelor's in health science, he brings this really unique blend of medical expertise and business acumen to the table. And before stepping into this leadership role, Mayur was able to hone his skills in the healthcare space, giving him a really deep understanding of both the science and the impact of hyperbaric therapy on overall health. So Mayur, thank you so much for hanging out with us today. When I got to come down and visit you guys, it was truly such an incredible experience.
Yeah, of course. And thanks for having me. We're at a very exciting time in the field of health and wellness, and honestly in the field of medicine. So I'm happy to be here.
Now, let's kind of start with an easy question. Is for those that don't know what hyperbaric oxygen therapy is, can we break down what it is so we can kind of get a handle on it?
Of course. Hyperbaric therapy is actually a fairly simple concept. What we're really doing is we're taking the driving force of pressure, something we already use to take oxygen from the air we're breathing, and we're increasing it. So by increasing the pressure, that driving force, we're now able to really drive more oxygen into your blood plasma and into various tissues in your body. And in doing so, that of course has a cascade of a lot of the different benefits and therapeutic. For example, oxygen is one of the rate limiting factors in ATP production. So by introducing more oxygen on a cellular level, by driving up the pressure and increasing that driving force, we're now able to really force your body or help facilitate more ATP production, so more fuel for your cells to really optimize themselves. And of course, that's just one of the many mechanisms that it does. We can also see an effect on inflammation and also an effect on stem cells. But really the key concept here is just using pressure to drive more oxygen into your body.
Now, I think some people may be familiar with the hyperbaric chambers that you would see in hospitals, right? That's traditionally where you would see that type of therapy. So now with OxyHealth, you guys have actually been able to make this into a portable hyperbaric chamber. Your dad actually pioneered this decades ago.
Yeah, actually, that's what OxyHealth is really known for, actually. So traditional hyperbarics were very much reserved for hospital settings for life-threatening indications because of the associated risks with not only oxygen toxicity, but also the fire risk. Traditional hyperbarics are hyperbaric vessels that pressurize with 100% oxygen. Because of that, there is a pretty significant risk associated with it. So it was really reserved for very select few things. So things like carbon monoxide poisoning, necrotic tissue, non-healing diabetic wounds or ulcers when those patients are on the verge of amputation. So as you can kind of tell from that theme, these are all very life-threatening type of indications. However, my father, he's the founder of OxyHealth, had introduced this concept of air over oxygen. Now with this concept, rather than pressurizing with 100% oxygen, he had built a concept where the unit would actually pressurize with ambient air and deliver oxygen directly to the patient's lungs via a mask, nasal cannula, or hood system. This wasn't really a well-known concept at the time, but over the past 30 years, we've actually seen quite a bit of safety data around this concept, and it's really opened the door for a lot of physicians to now consider a therapy that was relatively high risk. So now consider this therapy for things outside of the original scope for some of those life-threatening indications, which is why you see hyperbarics being used a lot in sports recovery, TBI, dementia, autism, stroke, inflammation-based disorders. My father actually built this concept to be put into a portable unit that can actually go into a home. They don't go to higher pressures, but they're mild systems where you can still take advantage of that driving force of pressure to get a hyperbaric treatment.
When I came down to your headquarters, it was so fascinating listening to you and Hans, one of your partners there. The stories you were able to tell, the experience that I had was so amazing, and I really didn't expect it.
I think what would be valuable is just to explain why the body needs oxygen. What happens when the body does not have enough oxygen? I think it's super important for everyone to understand that.
Well, as we age, for example, we tend to have a decrease in circulation and a decrease in oxygen delivery to our various tissues, which is part of the reason of why we age to begin with. So if there's less oxygen available, there's less ATP production, there are less factors in place to really help support your body to continue functioning as it really needs to. And so this is why we see cognitive declines and various declines of different organ functions as we age, is because of factors like a decrease in overall oxygen availability. And so to answer your question, a lot of diseases can stem from mitochondrial dysfunction or can stem from hypoxic, relative hypoxic, chronic hypoxic conditions. And the reason being is your body's not able to create the energy it needs to continue functioning the way it's intended to.
Yeah, throw in some low macronutrients, low water, have all these symptoms, not enough oxygen, acidic body, and would you not agree that we have a cascade of inflammation and disease just waiting there?
So a lot of various factors can really come into play for a lot of various disease states, and of course one of them in our area, in our field, is oxygen.
Yeah, and I found it so interesting. So when we went down to your headquarters, I didn't really know what to expect. I'd never experienced hyperbaric therapy before. I knew a little bit about it, but again, mainly just more hospital setting. So I wasn't sure I would even feel any difference in doing a session. So I went into what was the big tank that we did?
Oh, the 40th.
Yes, it looks like this really cool like spaceship feeling where you open the hatch and like you go and sit in and like you turn the wheel to close it in. And it was actually very soothing because you guys had it all like set up with pillows and everything. And it was great. I was sitting in there and I was really just getting some footage while I was in there. And then around the 25-minute mark, all of a sudden I had this immense sense of calm that I don't think I've ever experienced maybe since I was a child. And it's almost like the constant hum of anxiety like lives in my nervous system at all times that I just got so accustomed to. It's like someone turned the light off and that anxiety was totally gone. My nervous system felt calm and regulated, not on edge. And I was thinking, am I making this up in my head? I was in there for 30 minutes and 40, 45 and an hour. And this level of calm just continued to really regulate everything in my body. I've never been able to duplicate that. I've never been able to feel like that. And it was such an incredible thing to experience. So many of our audience listening, they suffer with mental health issues, whether it's anxiety, depression, mood imbalances, and to be able to have that anxiety just go away was so incredible. And it was only within one session. So I can only imagine what it would be like if I had multiple sessions in a row.
That's actually a pretty common phenomenon. So right around the 15 to 30 minute mark, that's where we see an activation of your parasympathetic. So your body is put into this rest and digest mode. A lot of patients, such as yourself, will explain that as like a feeling of calmness that just kind of sets in. I myself use it actually for a lot of that calming effect on a daily basis. Very nice Zen feeling. And also outside of what it does inside of your body, sometimes it's nice being unplugged from the world for about an hour inside of your hyperbaric chamber as well.
Yeah, just like disconnecting, not speaking to another human being, getting off the internet, like that's so therapeutic. I just found it so interesting that I was able to experience that in just the very first session. Let's kind of talk through is what types of issues can hyperbarics be really helpful for? What are really the main reasons people are utilizing it?
Because it's very broad in what it can do, let me start by going over some of the short-term benefits, things that you'll see from individual sessions, and compare that to the long-term benefits. And that'll really tie into what you see hyperbarics being used for today. Because across the world, hyperbarics is actually used for 120 plus off-label indications. Just a few, right? I think if I cover those, we can kind of get an idea of why it's so broad, because again, it's really just enabling your body's innate ability to repair and recover, which of course can be a foundation block for various things. Let's talk about short-term benefits. So when you're inside of a hyperbaric session, let's say it's your very first time, such as yourself, right off the bat, with that extra oxygen supplementation on a mitochondrial level, we're already seeing improved mitochondrial function. So your mitochondria has all this extra oxygen it didn't have access to before and is now able to output more ATP, so more cellular energy for your cells to really optimize themselves and do what they're intended to do. Outside of that, another short-term benefit we see is reduced inflammation. So hyperbarics actually has a very strong anti-inflammatory effect. And you'll see this in research in various studies actually over the years. Hyperbarics has shown off of one session to have a significant effect on pro-inflammatory markers, reducing the markers that promote inflammation, increasing anti-inflammatory markers, and also delivering oxygen to those selective tissues to help kickstart and promote that recovery to overall reduce inflammation. Because remember, inflammation is actually one of the steps of healing, but it's also an inhibitory step. So it's necessary to some extent, but can also inhibit the healing as well. If we can help facilitate the healing aspect by delivering oxygen through some of those pathways that may be blocking off some of your red blood cells, now we can really further along the healing process and go from the inflammation phase to proliferation and start that whole process. And of course, there's an effect in the short term on your immune system function. So a lot of this ties into what it does with your ATP and also in the controlled stress that we're putting your body through. So your body, in a sense, hyperbarics is actually a controlled oxidative stress. Oxidative stress is technically bad for us to some extent, but we're putting you through a controlled simulation to trick your body into optimizing itself. And in tricking your body and in optimizing itself, there's a pretty significant effect in what it does as far as those protective mechanisms, one of which is the effect it has on your immune system. For long-term benefits, this is where we really see the true power of hyperbarics come into play. One general concept you may hear around hyperbarics is the hyperoxic-hypoxic paradox. Now that paradox is in a sense the intermittent exposure of going back and forth from our normal environment into a hyperbaric, hyperoxygenated environment. Now, when we go back and forth intermittently, it tricks our body into thinking we're actually in a hypoxic setting, even though you're not actually in a hypoxic setting. But through the variations in the oxygen levels we're exposed to, it's a way to really trick your body into activating what's called HIF-1 alpha. That's your hypoxic-inducing factor 1 alpha. And this is part of the reason why hyperbarics has such a strong effect on your stem cells, because through that activation, there's a cascade of events that leads to mobilizing your stem cells from your bone marrow into your blood circulation. If you have a lot more stem cells mobilized through your body, circulating throughout your body, now your body's really primed for recovery, right? Stem cells are unprogrammed cells looking for work to do and to fill various demands in your body. After the age of 30, I believe, we actually have a pretty significant reduction in the amount of stem cells we have already in our circulation, which is why athletes after the age of 30 have to take extra precautions and care, because they can't bounce back the same way they did in their 20s. Why? When you're in your 30s, you can't bounce back to the same extent and as fast as you did in your 20s, because we naturally have a decline in circulating stem cells. So this is a modality that can help really force your body to mobilize more of those stem cells by introducing controlled stressors along the way. And so with that said, the effect on stem cell mobilization is one of the stronger long-term benefits we see with hyperbarics. Also, with putting your body through these intermittent exposures, we see things like angiogenesis at play, right? So building new vasculature, new circulation pathways. So for somebody, just your average person who's aging, as we age, we have a steady decline in circulation. I'd say countered to some extent by building new circulation pathways to really make sure you're maintaining that adequate circulation as we age. We also see a release of various growth factors, tissue repair and regeneration, long-term mitochondrial improvements. So in the short term, it's getting your mitochondria to pump out more energy. But in the long term, our bodies adapt. And so those mitochondria are not only getting bigger inside, but they're also more in number. I like to use the engine analogy all the time, right? You have a 4-cylinder engine, now grows to an 8-cylinder to increase its capabilities based on the resources available. But also on top of that, we're also increasing the number of engines. And so a lot of athletes actually have more mitochondria than your average person because they have that demand and their bodies are adapting, right? Because they need it. So for your average person who doesn't, this is a really effective way at really focusing on optimizing mitochondrial health overall. And then from a cognitive standpoint, we see things like neurogenesis, neuroplasticity, right? So supporting neuroplasticity. And with that, a lot of the benefits we see from that are improved cognition, improved memory, cognitive processing skills, motor skills, reduction in neuroinflammation. So whether it's autoimmune related or just a result of environmental factors or some underlying issue causing neuroinflammation, this is a really effective way to help reduce some of that neuroinflammation because of that strong anti-inflammatory effect. It has a very broad scope around regenerative medicine. Because of that, some of the things that we'll see hyperbarics used for in the industry, some of the off-label things are, of course, sports performance and recovery, which is probably why I was referring to athletes earlier. I'm always, when I think of recovery, I'm always thinking of the athletes that we work with. But this can apply to anybody, right? So we have patients that actually use hyperbarics pre and post recovery, whether they're getting some kind of plastic surgery or any other kind of surgical intervention to really make sure they're priming their body to be in that recovery state, especially when you're looking at a lot of these long-term benefits. It's really important to kind of prime your body and upkeep itself in a preventative measure. We'll see hyperbarics being used for things like autism, TBI, dementia, stroke, chronic fatigue, diabetes, even some fertility actually, fibromyalgia, inflammation-based disorders, Lyme disease, so again, more autoimmune, PTSD. I always like to bring it back to what it does inside of your body, because if you can understand what it does, now you can put 2 and 2 together to see if this is a right fit for you. And physicians can now put 2 and 2 together and connect the dots to see how they can apply this to their patient bases.
Yeah, it's such a really fascinating world. When I was talking with you and Hans, like every story you told me, every, different way it's been utilized, it was just so mind-blowing to hear how many different benefits it can have. But I like that you said when you can understand what it does in the body, you can see how it applies to you. Now, I know you talked quite a bit about mitochondria. So Chris, I know this is a topic you absolutely love. So just give a quick rundown, Chris, why mitochondria is important in the body.
You want to get up in the morning? You want to process your food? You want to laugh, you want to smile, you want to move your body in order to pick up that glass of water because hydration is key. You want to do anything in life, including sleep, you need mitochondria. Mitochondria really is supported by not only oxygen, we need the electron transport, which is water, as well as part of that process. There's some other fancy acronyms that we won't get into. However, your mitochondria really needs your macronutrients in order to do the turnover as well. So you see those cofactors. If you want to optimize health and longevity, your mitochondria is codependent on what and how your body is going to output.
It's such a cool part of regenerative medicine. And Mayur, I think this is where we can really look to see, like, where is medicine going in the next year, 5, 10, 15 years to see, like, can hyperbarics really be an integral part to a person's overall health? First of all, how many different chambers do you guys have out in this big world of ours?
We have over 18,500 chambers in the industry today. We have quite a few out there.
Quite a few. And you guys have been doing this for how many years now? When did your dad first start OxyHealth?
Founded this in 1998. We're almost at 30 years.
This was before health and wellness was a thing. Like back in 98, nobody cared about health and wellness.
No, actually, back in 98, Hyperbarics was something that, again, was reserved for very few select indications. Where it really started was with autism. Autism is, of course, what put us on the map. It really started off by treating individuals who were really sick. And in the last 5 years, we've seen an accelerated growth and a shift in that mindset to how something like hyperbarics and other modalities in the health and wellness space can be applied for preventative medicine, right? For people that are already healthy, but just looking to maintain that longevity.
It's really incredible to see the different amount of applications. And you've mentioned a few times that athletes, it's really great for athletes. You're on the internet, you've probably come across a clip of LeBron James utilizing not only hyperbaric oxygen therapy, but one of your portable chambers, and he's utilizing that as part of his pre and post recovery.
He's probably one of our biggest advocates to some extent. I've seen quite a bit of footage of him using our specific chamber. He, of course, has the home model, right? So this is something that he seems to build into his daily recovery routine. But athletes like LeBron are really looking at ways to combat their aging to stay in their prime. I mean, we're at a point in time where we have athletes creeping up on the 40 age mark that are still performing as they did in their prime. And I really attribute that to different modalities like hyperbarics that can help kickstart a lot of these mechanisms and counter what we call aging, right? So we're not necessarily helping individuals live longer, but we're ensuring that the time they have on this planet, they're maintaining to the best of their ability the quality of life they have for as long as possible. So for a high-performing athlete, it's absolutely crucial that you try to stimulate as much stem cell mobilization, right? That you're supporting your mitochondria to be as best as they can to produce adequate energy for all your various cells and tissues. So a lot of cool devices, I think, now that are research-based, like hyperbarics, that can help accomplish some of these.
Now, LeBron isn't your only high-profile client. Who are some of your other high-profile clients that are utilizing hyperbarics in their day-to-day?
We have Terrell Owens was actually one of them. He was one of the original NFL players that had a big story around hyperbarics. And this was back in 2004, actually. And he had a torn Achilles, I believe, or a fractured bone somewhere in his ankle. And he actually was told by surgeons that he wouldn't be able to make it to the Super Bowl because the Super Bowl is in 7 weeks and nobody's ever made this miraculous of a recovery. So he took it upon himself to venture off and try various modalities. He gave us a call and we set him up with the home hyperbaric chamber, and in 7 weeks he played in the Super Bowl. And he didn't just play, he ran, I believe he ran 71 yards, which is remarkable for somebody who had a torn Achilles at the time. In the recent history, we worked with athletes like Aaron Rodgers, some of the players on the Orlando Magic as well. A good 10% of the pro athlete space that actually specifically use our products, about half of the pro athlete space uses hyperbarics in general, which is pretty remarkable.
And I've even seen your hyperbaric chambers like pop up on the Kardashians as well, like Bieber, Usher. It's not just selected or kept to athletes, it's performers in general.
Yeah, any high-performing individual, because again, fatigue is a pain point for a lot of these individuals, whether you're an athlete or a performer. They use things like hyperbarics to help with a lot of their breath work, to really help with their chronic fatigue and to have more energy on a daily basis outside of the longevity effects. Usher's another one. Anytime he has performance, we actually go and ship him a unit to his site. He'll contact us and we'll ship it there for that weekend or a short period of time and take it back so he can upkeep his therapy.
And it's not just the high profile clients that you have. You have everyday civilians, you have veterans using this, you have parents with children that have, different illnesses. So could you give a few of the stories that you had shared with me previously? Because I think you can really see how they're making a difference in the lives of everyday people. It's just so incredible.
One of the most touching stories is actually Eden's miracle. 23-month-old baby who had gotten around somehow the gate and had fallen into a swimming pool. And so she was a near drowning patient. When they found her, she was non-responsive. She had been for several hours without any oxygen. They conducted a lot of CPR for like 30 to 60 minutes to try and resuscitate her. When they finally did, of course, she was not in a state where she was even responsive. They had deemed that she was potentially even brain dead. Various brain scans showed that areas of her brain were actually, in fact, no longer active. The parents didn't really know what to do, so they took her to Dr. Paul Harch's clinic. He's one of the most well-known hyperbaric docs in the industry. After conducting 40 sessions at his clinic, she snapped back. I mean, I'm sure because of her age, you have a lot of neuroplasticity and a lot of potential for growth. But when supported with hyperbarics, she had a complete reversal on the damages in the white matter on her brain and is now living a very normal life, which is really remarkable. And it really shows the power of something like hyperbarics and supplementing oxygen on that level, and what you can do for somebody who at one point had a brain that was starved of oxygen. Outside of that, we've had individuals in the autism world, for example. We have stories where children were able to speak to their parents for the first time. Being in that moment, hearing a child speak for the first time in their life to their parents is really such a touching moment. If you're there, there's not a single dry eye in the room. It's really amazing to be a part of, and a blessing and an honor to be in a position. Everyone here at OxyHealth, we all feel extremely fortunate and grateful to be able to see this impact in what we're doing on the world and giving people a chance to redeem their quality of life and giving a chance to grow.
And it's really incredible what the hyperbaric therapy has been able to do for veterans suffering with PTSD. Where think about they coming home from war, they've seen horrible things. They're not able to go back into life, integrate back into life. They are not able to be that person they once were in their family. They're pulling away from their family. But through using hyperbaric oxygen therapy, they've been able to integrate so well.
Yeah, with PTSD, there's actually a lot of hypothesis around PTSD, but what we found is a lot of PTSD patients or veterans suffering from PTSD respond so well from hyperbarics because there's an underlying traumatic or TBI, traumatic brain injury, that's causing a lot of these various symptoms. And this can be from blast waves or shocks waves. In the research that's out there, there was actually a study at the VA that was done with veterans with PTSD, and they found that hyperbarics was very effective in reducing a lot of their PTSD symptoms because it was able to heal the underlying issue, which was some kind of brain injury, whether it's a TBI or concussion of some sort. We actually support our veterans as much as we can. We work with nonprofits that actually have clinics that treat and support veterans completely free. So we've strategically placed chambers around the country at some of these clinics. One of them is the Grey Wolf team. So the Grey Wolf team, they're somebody that I work with closely to some extent, where we can actually treat veterans for a lot of the issues and complications they're dealing with, things like hyperbarics. Something we stand by and looking at new opportunities to better support those communities.
So Chris, I know I've been hogging Mayur because I just love hearing all of these stories. So what's your brain thinking?
Actually, no, what I was thinking about the veterans is it would make sense because earlier you talked about how 15 to 30 minutes the body goes into parasympathetic state, where veterans, they tend to stay in that sympathetic dominance, that fight or flight, that constant warlike behavior, right? Where everything's on all the time. So the fact that even this oxygen can convert them into a different operating system for the nervous system to calm down. That alone, not just even the output through the ATP and the oxygen infusion, all of these beautiful things, but that alone allows the body rest. Can you geek out a little bit on that? When we look at that, what are the connections when they revert into, or anybody going into that reverts into the parasympathetic, which calms down the pro-inflammatory state, allowing us to come out of the sympathetic dominance?
It is, of course. I mean, without rest, our bodies can't heal. So if anyone were to ask me, what's one thing, if I were to do one thing at all, what's one thing I can do to really help support my healing journey? And that's make sure you're getting 7 to 8 hours of sleep, right? Let's focus on your sleep first, because without sleep, you can't make any progress in any healing, to be honest. And so something like hyperbarics can help promote that rest and digest state, putting you into a state where your body is ready to heal and recover. Of course, this isn't like a one-all. This is just a supplement or support mechanism that you can use to help facilitate that. But it's really important to make sure that you're at least covering the basics for a proper foundation, and that starts with getting adequate sleep.
We say this every episode, Mayur. We say, please get 7 to 9 hours of sleep every single night. I don't care what your issue is. If you sleep more, you're going to feel better. So, Mayur, obviously being here in the Clear Skin Chronicles, we do skin health. So I would love for you to be able to share, how can hyperbarics really improve the health of the skin, whether it's through the skin directly or through those other body systems that integrate with the skin?
So for skincare, it's actually part of the reason why the Kardashians were using our product to begin with, is hyperbarics has a pretty strong effect on collagen production. So when it comes to skincare, if you can stimulate collagen production, now you can really help support skin elasticity, right? And overall firmness. That's probably one of the biggest things for skincare, is what the effect it has on your collagen production. Another one is angiogenesis, right? So with angiogenesis, we're building new circulation pathways, but it goes a little bit further than that. We're building new capillary beds. Skin is actually, as we age, we have less and less circulation, which is why our skin gets so dry. There are other factors, of course, with chronic diseases, like if you're diabetic, for example. But overall, we have less and less circulation going to our skin, which is why our skin has this steady decline as we age. Something like hyperbarics can now help facilitate and stimulate angiogenesis to build new capillary beds and to really make sure that we're maintaining adequate flow and oxygen delivery to our skin. So that's really one of the largest effects it has for the rejuvenating effects you'll see with skincare. Outside of that, with inflammation, a lot of skincare is affected by inflammation. Hyperbarics has a very strong anti-inflammatory effect to help bring down some of that inflammation. If you're having some kind of autoimmune complications, which is leading to various patches forming on your skin, now if we're able to use something like hyperbarics to regulate your immune system and really calm it down, that can help attack the origin or primary cause of some of these complications that you're seeing present on your skin. The effect it has on bacteria. So bacteria don't thrive in high oxygen environments. Some bacteria do require oxygen, but they're not as resilient as we are. So our bodies can handle a controlled oxidative stress in a hyperbaric chamber, for example, but bacteria can't necessarily handle it as well. And so they're almost immunocompromised to some extent. And so by putting them in a high oxygen environment, you're now suppressing their ability to grow and maybe even decreasing some of the populations there. And so that, of course, gives your body a chance to really optimize itself. And it's not like you're submerging yourself in a hyperbaric chamber 24/7, but it's just enough to stunt it so your body can have time to catch up and overcome any of these issues it may be having with things like bacteria and other microorganisms.
It's so cool. Like listening to you talk, you can see how this application can go from anywhere from someone wanting to improve their skin health, help with slowing down aging, helping to be more preventative, all the way up to people dealing with traumatic brain injuries, autism, whether you're an athlete, whether you want to just support the overall functioning of your body. There's so many different applications. So for somebody that wants to utilize hyperbarics in their day-to-day, what is there like a standard, protocol of everybody does this, or it's more dependent on what you're going in for?
If you recall the whole short-term and long-term benefit, as you can imagine, you really want to try and get the best of both worlds with both the short-term and long-term. Now, with that said, this isn't a one-and-done therapy. So you can go in once and you can get a lot of the short-term benefits, but to really get the most out of it, especially when you're looking at things like longevity, and especially if you're attacking a specific issue, you want to be as consistent about this as possible. Now, for your everyday person who just wants to use this for longevity, if you were to ask me, for example, should I do this once a week for 52 weeks out of the year? Or should I find 1 month out of every year or a 2-week span and really try to consolidate as many sessions as I can? I would say go with the latter of the two. The reason being is you want that consecutive exposure and the frequency to get that intermittent exposure to stimulate a lot of the longer term benefits. And so typically what we'll see are patients actually allocating 1 month out of every year to complete 20 sessions. Now, if you don't have one in your home, for example, and you're going to a wellness center, a lot of patients will pick twice every year. They'll pick a 2-week period or maybe 3-week period, and they'll complete 10 sessions in that 2 to 3 week time. And so that'll really help kickstart a lot of these mechanisms, and it's more of like a maintenance therapy. Because if you just do one, it's really going to do nothing for you. You'll feel a lot calmer in that session. You'll reduce some inflammation. You'll build some cellular energy. But we're really looking at how do we give patients the most durable effects as it pertains to their health and their health goals.
And so you mentioned that people can also do the hyperbarics in a clinic, whether it's with a medical professional or a wellness center, but people, especially those living in the US, can have these portable chambers in their home. And I was able to try a few of the different ones that you had in your headquarters. Is there a difference in the benefits that you would get from, say, one of your soft chambers to one of the hard chambers?
All soft chambers per FDA regulation are regulated and limited to 1.3 atmospheres. So this is a mild hyperbaric chamber. And this is what my father had brought, almost 30 years ago now, is introducing the concept of a mild hyperbaric chamber that had less safety concerns, right? Because the higher, even though we're not using 100% oxygen in the steel chamber, the higher the pressure you go, the higher the risks get, whether it's from a physical barotrauma event, the drastic change in pressure, or from oxygen toxicity. It's still a possibility regardless of what pressure you're at, depending on how sensitive you are to oxygen. Now, with that said, in these ambient air chambers where we supplement oxygen, it's a lot less likely than it is in a 100% oxygen chamber. For someone who's using this for general health and wellness, or a lot of athletes that use this very routinely, like LeBron James, they'll actually use the mild portable chambers because, again, it's an oxidative stress, right? So there is a such thing as too much. And you really have to kind of simmer the pot, because if you go too far on one end, that's a lot of stress on your body, right? So we don't want to stress the body out too much, but we want to stress it out just enough for it to start optimizing and kick-starting a lot of these healing factors. Very similar concept to like intermittent fasting. It's a very mild daily thing you're doing. Now, the hard chambers, where they really come into play, is in delivering a larger dose of oxygen, but that larger dose of oxygen is necessary and justified because you're attacking a specific issue. So whether it's trying to suppress some kind of autoimmune dysregulation, right? Or if you're trying to suppress some kind of bacterial growth, or if you have an acute injury and you want to have the fastest time to effect, you are getting a dose of oxygen in every session. So with higher pressures, now you're getting a larger dose, and you can now potentially have a faster time to effect overall. But it's not something you want to do long term because of the amount of stress it puts your body through. So it's all about finding a balance. They both have their time and place. I will say, to kind of sum it up, higher pressures are really used for individuals who are sick and looking to attack something specific, and mild pressures are more for like the general health and wellness recovery aspects that you'll see, especially more widespread. But you never really want to put a high pressure chamber inside of a home. It's a medical device at the end of the day, right? So there is a prescription requirement, and there are risks associated with hyperbarics that significantly go up as we go to higher pressures. So you want to make sure if you're using a high pressure device that you're doing so in a medical facility under direct supervision of a physician, so that way they're well equipped for any type of event. So just to keep things simple and easy, hypoglycemic events. Low blood sugars is actually one of the adverse events that can happen because of the metabolic effect that hyperbaric has. So it's very effective in reducing your blood sugars, but if you're diabetic, you don't know any better, and you're using this at home, that could be potentially problematic, especially when you're going to high pressure. So it's really important to, especially when you're going to high pressures, to work with a physician that's experienced and trained on this, to make sure that they're well equipped and that you're well educated on what you're getting into and what the associated risks are.
Now, Chris, before we finish up, do you have any lingering questions for Mayur?
It's great. It's just all nice flow. It's all great information.
I know we're pre-recording this episode, Mayur, but when it airs, it's actually going to be the week before you guys are going to Dave Asprey's biohacking conference. And you were saying that this is one of like the biggest events that you guys do. So if people want to come and check out OxyHealth, come and experience it, they can see you at the biohacking conference.
Yeah, come check us out at the biohacking conference. That's one of our largest conferences. So it'll be hard to miss us. You'll see a giant 20 by 40 booth with an OxyHealth branding all over it. And we'll actually have hyperbaric chambers there to do demos. So we have various screenings to make sure that, we can get people in and physicians on site. So just come check us out. We'd love to show you more of what hyperbarics can do.
Where do you see the future of hyperbarics going, let's say in the next 2 to 5 to 10 years?
I see the future of hyperbarics going into preventative care and preventative medicine. So I think there's a paradigm shift going on right now. When you hear the term preventative, it used to just be vaccines. Now it's really shifting into what can I do now to make sure that I'm still healthy 20 years from now. And I think modalities and therapies like hyperbarics will be a very big part of that, right? And really making sure we're able to optimize to the best of our abilities, because what we do now will reflect in 20 years. So we may not see it next year or 5 years from now, but the choices and decisions that we make right now will reflect in the second half of our lifespan. And so it's very important to make sure that we're staying on top of things. And this environment's only getting more toxic. It's ridiculous how many toxins we ingest and are exposed to on a daily basis. And it's our own fault, right? We're human beings, we're innovative, we have all these devices, and a lot of the byproducts of this innovation has put us and submerged us in such a toxic environment. And so you may not present with various symptoms, but a lot of people suffer from things like chronic fatigue or brain fog. People question why. Like, they're perfectly healthy. Why do I experience these various things? And we live in a very toxic environment. So using devices like Hyperbarics can help rid these toxins from our body and give us that little push that we need so we can continue performing and be as effective as we need to be in our daily lives.
I love it. I'm going to have to add to cart. Mayur, Chris and I are both going to be getting a hyperbaric chamber sent to us, because you can see how amazing this could be for so many different issues, whether it's for general health, for athletes, for bigger illnesses and diseases. It really truly can be such an integral part to allowing people to not only feel better now, but to feel better in the future. So Mayur, thank you so much for hanging out with us today on the Clear Skin Chronicles.
Of course. Thanks for having me.
All right, everybody, that's another episode here with us. We will see you next week on another episode of the Clear Skin Chronicles.